Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today on the show, we welcome back Lisa Yeh. She's a psychiatrist, and her Kevin MD article is titled, Let's Address the Needs of Millions of Students with Sensory Processing Disorders. Lisa, welcome back to the show.
Thank you so much for having me back. It's a pleasure to be able to talk with you again and your listeners. So I wanted to start off a little bit about who I am. I am a psychiatrist. I'm also a child adolescent psychiatrist. I am the medical director of an autism center at Rush University Medical Center in Chicago. And for almost 30 years now, I've been really working with children with autism and any kind of neurodevelopmental disabilities. I started off at Children's Memorial Hospital, which is now called Lurie's Hospital. And from there, I kind of moved into Illinois Masonic Hospital, which is also a place in Chicago at the Pediatric Developmental Center. And then since 2018, I've been part of the Rush University Medical Center family.
So take us through a typical day of what you do. What are some common cases and common treatments that you would do in the exam room?
So since I predominantly are working with people that have autism, I specialize in people who have actually more difficulty and significant impact from their autism. But I also see a range of people who have higher cognitive, higher verbal abilities. The clinic that I work in is a lifespan clinic, so we see 0 to whenever. My youngest child right now is 2 years old, and my oldest is 76 years old. So I can kind of see the impact of things over a lifespan and really am very aware of how it's important to get early types of treatments and early recognition of things, because if it wasn't done in adulthood, how much it impacts them and their ability to kind of function in whether it's some sort of a job or in their relationships or even in day programs or residential treatment, anywhere that the adults are going into, making sure that we recognize early on some of the issues that are going on. I also do a lot of training for medical students, residents in psychiatry, and developmental pediatricians, as well as fellows for child adolescent psychiatry. And one of the things that I see is there is this difficulty in separating out sensory issues from autism. Everyone thinks if you have a sensory issue, it must be autism or some sort of other neurodevelopmental disability, but that's not the case. That there are people without autism or without a neurodevelopmental disability or any type of a disability that also have a sensory issue. And it is really important that we don't forget those kids that have those issues.
So give us a definition of a sensory processing disorder.
So what a sensory processing disorder is that we have five senses, so that there's either a heightened a sense of one of those five senses, so that sight, smell, touch, hearing, things like that, or they have a lower sense of it, so that they can be either what we call hyperaroused, it's a hyper sense of it, or hypoarousal, which is that
Mm.
lower sense of it. So what happens is that if they're like hyper aroused, that they may be certain noises may just set them off and they get really agitated by it. So for non-autistic individuals, one of the things that people might see is that they think their parents are yelling at them and the parents aren't yelling at them. They think that somebody is having a really mean tone to them when they don't have a mean tone to them. They're just super sensitive to those little nuances of our tones that they misinterpret them in a way. Other types of things that they can't sit in circle time in school or be in the middle of a line, that they seem to kind of get really out of sorts by that. Or that sometimes I'll see that the lights are too bright in the school, or sometimes even in like the offices, that there's just they can't stand the typing of the computers or something like that, that doesn't seem for people without any sensory issues that should be an issue, but that people are getting agitated because of even slight types of increases in sensory things. For the hypoarousal, those kind of low arousal types of people, that they kind of need sensory input, something kind of strong to kind of help perk them up. So one of the things that I do is that I am specializing in looking at people about whether they have autism or not, this kind of confirmation of the diagnosis. And a lot of the kids that come in, that they kind of have symptomatology that look like they have autism, that they don't have good eye contact, they are not communicating very well, they don't really know how to make friends, they're not like enjoying in that's kind of well, that kind of back and forth type of relationships as much. But when I see them, they look really low arousal, that they kind of look low energy. And if I give them input, so I kind of have them jump around or I have them run around, and then they look at me and they perk up and they interact and they do what they should be doing in a non-autistic way. And so that is one of the things that these kinds of kids are sometimes just passed off as having autism or some other type of disability. And really what they have is a sensory issue, and they just need that kind of input to perk them up and get them engaged in the world for them.
So you talk more about this in your Kevin MD article titled "Let's Address the Needs of Millions of Students with Sensory Processing Disorders." Now, for the parents out there, how can they tell whether to bring their children in for a potential sensory processing disorder? How would they present? What are some of the things that they should look out for?
If they're kind of concerned about those social communication things, that the kids seem really super low energy, that they're not really getting things done, they don't seem to be looking at them or having lots of eye contact to them, I would say look at whether they, if you can, just have them, do they enjoy sports like basketball, swimming, yoga types of things that are kind of have lots of input and activity level, if that makes them look more excited and happier, but when they're not doing it, they don't seem to be connecting with people. I would say I would ask their regular doctors to have an evaluation for that. There are some screeners that they can do. There's a short sensory profile, which just takes a few minutes to be able to do, or they can refer them for an evaluation through occupational therapy. For those who are more hyperaroused and hypersensitive to things, these are the kids that I tend to see are more reactionary. That they get upset over something that doesn't seem to be, should be getting them that upset. These are lots of times, these are very dysregulated ADHD kids, that they seem to get really super angry about something and you can't figure out why they're getting angry about it. And so if the parents kind of think about it, when we have a high arousal level, it's over the top already. If they had normal arousal level, a little bit of something getting them upset is still well within range of manageable. But if they are already hyper aroused and over the top, that little bit kind of puts them over the top even more. So they seem really reactionary. And so those are the types of kids which oftentimes clinician will say, oh, we just need to medicate them because they have a mood disorder or, you know, that type of a thing. And really what it could be that they have a sensory issue, and that can be then evaluated to see if that's the case, because then we don't necessarily need to go towards medications to help out for that. And sometimes we can really help kids learn how to self-regulate themselves. Other things that we may see is that kids kind of bump into people. I see a lot of parents yelling at their kids, stop bumping into me, or don't bump into that. That may be a sign that there might be something going on, that they're trying to naturally get their own sensory kind of input, because bumping, pounding, breaking of things actually is sensory input that helps regulate their sensory system. And so sometimes these kids look like they're doing negative behaviors when all they're trying to do is help calm down that sensory system for themselves. Other things that we may see is this really disrupted sleep, that they just move around a lot within sleep, that they just can't seem to settle, or they need tons of weight on them to be able to settle and sleep, or they are really sensitive to temperatures and they can't sleep because of the temperature types of things. So sometimes those are the types of kids also that may have a sensory issue for them, and that can be looked at because there are some sensory soothing things that we can do before bedtime to help soothe them, and we don't necessarily, once again, need to give them medications for that.
So if they present to you in the exam room, give us a spectrum of some of the things that you would do for them, and how effective are these treatments?
So what I do when I start to suspect that there could be some sensory types of things, I will do that short sensory profile for them. And what it kind of asks for, are they having sensitivities to noise? Are they, do they ever cover up their ears? Do they, so it could be things just more like typically that fireworks or things like that, school alarms, things like that, but they tend to do it over the top of what we would normally expect. for that. Or even if sometimes our sensory kids really like to make tons of noise, but they can't tolerate anyone else's noise. And that's the other type of a thing that I'll ask. Because sometimes they'll say, oh, no, they don't have a sensory issue. They have the TV on so loud, they speak so loud, but they can't tolerate it, though, when I speak or when we play music or the TV is on or their sibling is talking or anything like that. And so we can see them doing their own really loud noise, but they can't tolerate anyone else's noise. So I ask about that type of a thing. I'll ask about if they're sensitive to smells at all or to touch. Do they seem to get more heightened and agitated when that? Can they stand in line? Can they, if they're younger, do they do circle time? Do they kind of get upset and agitated when there's more people in the room? So I kind of go through those types of things. And then in an exam for them, I'll try out a few types of sensory input types of things. So for instance, I may have them, like I was saying, have the kids jump around a lot, have the kids run. I do have my chair in my office is one of those typical office chairs where you can swing around. So sometimes I'll bounce them in that chair or swing them around in that chair and see if that kind of helps settle them for a bit. So some of these really dysregulated kids in my office, I'll try to see if I give them some sensory input. Can they sit for a while? Can they be able to look at me and talk to me better? Or are they less agitated? Do they seem to be more comfortable? Because a lot of times they feel a little bit out of sorts when I'm seeing them. And so let's see what happens when I give that kind of sensory input to them.
So what proportion of the kids who are initially dysregulated, what proportion of them are treatable and eventually can lead normal lives?
Well, I think if we recognize what those sensory issues are, a lot of them improve significantly when they have the appropriate sensory input. Now, also keep in mind that as kids could develop, that developmentally their sensory needs may change, and so they may need sensory input. So sometimes I'll hear parents say, oh, it used to work, but now it no longer works. It just means that their sensory needs have changed, and you just need to go back and get another evaluation. But I would say that the majority of the kids that I see, that there is some improvement on it. Sometimes it's just significant, sometimes it's night and day, and sometimes it's just a mildly better sense for themselves. But I do see impact by it for the vast majority of the kids that I see. I particularly see that when they're non-autistic, it's because their world is very different and it is easier for them then to be seen in the way that they're working. And so I think the supports out there improve for that, where unfortunately a lot of my autistic patients, people tend to just say, oh, that's just autism. So even though they recognize that they have sensory stuff, they don't necessarily do all of the kinds of supports that they need because they just say it's autism and then they kind of forget to do that. But the non-autistic individuals, once they figure that out, people really kind of support it and work on it and kind of help them improve. So I do see that really changes a lot of kids' lives, especially for those friendship types of things, because these dysregulated kids don't really necessarily have those boundaries and they're too impulsive because of potentially they have their ADHD as well. And then other kids start to avoid them. Other kids don't want to be around them. They rough play too much. And some of the other kids can't get involved with them. So it improves their ability to socialize and make good friends and helps them kind of with their self-esteem if we are addressing the needs that they have.
We're talking to Lisa Ye. She's a psychiatrist, and we're talking about her Kevin MD article. Let's address the needs of millions of students with sensory processing disorders. Lisa, what are some of your take-home messages that you want to leave with the Kevin MD audience?
So I think it's really important that parents in particular are really aware of some of these possible sensory issues that their kids could be having. And if they are paying attention that they, oftentimes these kids get medicated and it's just not quite right, or they're multiple medications, start thinking about that as a possibility. Bring it up to your child's doctor about this, maybe even talk to the school teachers and see what they may have noticed within the classroom to start getting that information about whether this could be a true issue for your child. And as far as adults go, I would have to say that if you're noticing that it's hard for you to keep a job or it's hard for you to be in the workplace because there's too many people in the room, that you feel uncomfortable with the lighting in your office, that you feel really out of sorts by it, think about that as a possibility as well, and going to get an evaluation. And like I said, it's from occupational therapy that they can do the evaluation for it. Not all occupational therapists are able to do this evaluation. So make sure that you are going to one who is trained to be able to recognize this and then to get a treatment plan for what might be helpful for you.
Lisa, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you.